Hi there, I'm Shannon Piggott with Breed Specific Healthcare, and this edition of Ask the Expert, we have Dr. Nan Boss with Best Friends Veterinary Center here to answer some questions about how to implement breed-specific wellness in your hospital. And so, Dr. Boss, thank you for joining us today.
Thank you, Shannon.
Thank you. Well, one of the first questions that a lot of people ask is, why should we implement breed-specific healthcare?
To me, a lot of wellness and prevention consists of managing risks. So we vaccinate to reduce our risk of contagious diseases, we do parasite prevention to reduce the risk from parasitic disease, dental cleaning, etc. For purebred dogs especially, and quite a few breeds of purebred cats, the risk that they have from their genetics is at least as important as all these other risks that we worry about every day. So some of these breeds, things like GDV in Great Danes, 40% of Great Danes are sooner or later going to have bloat. That's a huge percentage. 100% of Cavalier King Charles Spaniels and English Cocker Spaniels will eventually get heart disease. We need to be taking these risks into account when we're planning health care for dogs that are purebreds and for dogs that we know what their breeds are if they're a mixed breed. Designer breeds often have risks from both sides of their families, and you have to take that into account too. So I want to be proactive in my wellness care. I want to think about urine screening for the Wheaten Terrier to look for glomerulonephropathy. I want to talk to clients about doing ECG screenings for Dobermans to look for PVCs that you'll often see ahead of clinical signs of dilatative cardiomyopathy. So I'm going to be taking into account not only the dog's age and its activities and where it lives, but I'm also going to take into account what that pet's breed is and how is that going to affect that pet's health. So I think this is really good medicine because, again, I'm going to catch diseases early. I'm going to be able to treat them early. Sometimes I can actually prevent diseases, so I need to talk to that Great Danes owner about stomach tacking so that that dog never is going to have a GDV problem. It's good medicine for your hospital. You're going to be doing a lot more laboratory screening when you start implementing this, so it's good for your bottom line. To me, the main benefit is that it's good for my patients.
You know, I really appreciate the story about the Great Danes and the GDV because that's a difficult decision for a Great Dane pet owner to make in the emergency hospital when they're faced with a multi-$1,000 procedure in the middle of the night.
Absolutely. And what bothers me, I think, about the lack of breed-specific wellness going on in hospitals right now, I've never had a Great Dane come to see me whose previous veterinarian had talked to them about GDV, and I think that's just kind of wrong. We're failing on that because how is that client going to know? We're the ones that went to veterinary school. The client doesn't know their dog has a 40% risk for this horrible disease. I need to talk to them about pet insurance, so if that happens, they can afford to have the stomach repaired, and I need to talk to them, especially when the dog is young, about tacking that stomach so it never happens. There's also some very simple things that clients can do at home that I teach them about. We used to think that if you fed the dog from a raised feeder that would reduce your risk for GDV. That actually increases the risk, so I'm going to tell my clients, feed your Great Dane with the bowls on the floor. There's studies that show that if the client mixes some canned food or people food in with the dog's dry food, that reduces the risk of bloat. So there's simple things that clients can learn to do at home as well that will help possibly save their dog from a serious problem. GDV, if you get your dog to the emergency clinic on time, it's got an 80% success rate from surgery, but as you said, it's going to be thousands of dollars. If you don't get the dog to the emergency clinic in time, they often die, and some of them die even with surgery.
Thank you for dialing in to ask this expert. Dr. Boss, thank you for your time and
You're
for
very
your
welcome.
insights.